Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. In this video, I'm going to be talking to you guys about how to know how to sequence appointments, especially for a new dental hygienist. This is probably one of the hardest things for you to kind of figure out, because if you're a new dental hygienist, you're not used to having to figure out yourself how often a patient should be coming in. Or in school, you did have to, but it was more of you had to go by certain guidelines, and you knew that you had to get certain patients, certain clients, so that's why they had to come in more often. Plus, you may not be sure of, well, if this person hasn't been in for 2 years, can I actually clean all of their teeth? Or is it okay to bring them back? So I'm going to be talking to you guys about a few things today that I hope will be extremely helpful, especially when you're starting to work in a new office. You know, you're thinking about so many other things that if you have to book their next appointment, this can be very stressful because you just simply don't know how to book the next appointment, and you don't want to make the patient mad by bringing them in too often or not often enough. So let me just show you guys my screen here, because I do have a screen up for you guys. Let's see, where is it? Oh, here we go. Okay, can everybody see my screen okay? I have a PowerPoint up here that says appointment sequencing, so Dentalelle Tutoring. So let me just move on to my next slide, because the main thing to know is that your patients will either be coming in every 3 months, every 4 months, every 4.5 months, 6 months, 9 months, or 1 year. So let me just move that over to my next slide, which I didn't actually put 4.5 months down here. Now, it does depend on your office, and I say this in all honesty because I have worked in offices before where it was either every 3 months, every 4.5, every 6, every 9, or 1 year. Now, those patients who were coming in every 3 months, it was because they were smokers, they had a lot of stain, there was a lot of bleeding, they had pockets of 4 millimeters or 5 millimeters, or they just simply wanted to come in every 3 months. But a huge factor, which it shouldn't be, but it still is will insurance cover it? But you still have to talk to your patient initially, though. Talk to them first and tell them why they should be coming in every 3 months, and then say, but if you like, I am more than happy to check with the insurance for you to see how much could be covered. But if it's not covered, this is how much you would pay for out of pocket, because this is necessary for your health. Another thing that I like to say is, you know, you were sensitive at the cleaning today because there was so much plaque, so much tartar. The gums were bleeding a lot. If we see you every 3 months, there will be less plaque, less tartar, less bleeding at each appointment. So next time, your teeth shouldn't be sensitive, or not nearly as sensitive. And then when the gums start to heal up, you will not be sensitive at all. That's the ultimate hope. So even for those patients who may say to you, well, if it's not covered, I don't really know if it's necessary. You know, that is what I say to them is, well, you were pretty sore at your cleaning today. Even if it's not covered, it is something that you should be having done every 3 months, because if you do, then it will not be sore. You will be a lot healthier, and you won't leave the appointment in pain, you know, and that seems to help out a lot of people. So you might be asking, well, Andrea, why would they be coming in every 3 months, every 4 months, or every 4.5? Because those are pretty close. Those are pretty similar. So for those patients who may just say no to every 3 months, so they may say to you, well, you know what, my insurance isn't covering it, I just simply can't afford it. Then I'll say, well, let's push it then to every 4.5 months, because 6 months is too long, 9 months is way too long. So how about we do a compromise and come in every 4.5 months, and then I say things to them similar to the first time, where I may say, because you had a lot of plaque, you have a lot of bleeding, if you come in every 6 months, that's just simply not enough, and we can't clean things properly each time because there's so much there. Now, not a lot of offices do every 4 months, but it does depend on insurance, because some insurances actually will cover every 4 months, but they won't cover every 3. If they cover every 4 months, they will absolutely cover every 4.5 months. So this is when I just sort of pick on it based on insurance. If they don't want to come in every 3 months, then I check to see if they would be covered every 4 months. If not, then they should be covered every 4.5 months, and then we go from there. So because people ask me often, well, how come it's every 4 months or how come it's every 4.5? There's no reason for it really, because they're pretty close, right? Or sometimes those patients may say to you, well, I can't come every 4 months, but almost every 5 months I can. So how about we do every 4.5 months? So it depends on the patient, it depends on insurance coverage, but they're pretty similar. Those patients who come in every 4 or every 4.5 months, it's kind of the same thing. They have a lot of plaque, they have a lot of tartar, the gums are bleeding a lot. They probably have pockets of, 4 millimeters, 5 millimeters, 6 millimeters, because pockets of 1, 2, and 3 is considered healthy. So anything higher than that, they should be coming in every 3 or 4 or 4.5 months. And this is what I say to my patients also. I will even say to them, you should be coming in every 4.5 months now. It doesn't have to be forever, but until things improve, let's keep you on every 4.5 months. And then as soon as things do improve, then we can see you every 6 months. So I do tell them too, if you're doing excellent oral hygiene at home, brushing and flossing, and seeing us, things will get healthier. It takes time. As soon as things get healthier, then I'd be more than happy to see you every 6 months, but we have to get to that point first. So if there's any questions about that, please just comment below and then I would be happy to help. So every 6 months is basically for your patients who have good oral hygiene. Their pockets are 1 to 3 millimeters at the most. They have light plaque, they have light tartar. Children come in every 6 months typically. Those are your patients who come in every 6 months. Even I have my teeth cleaned every 5 months to every 6 months. And I'm a dental hygienist, so I have light plaque and light tartar and light stain. Those patients who come in every 9 months, I don't tell a lot of people to come in every 9 months unless they just absolutely say to me their insurance will only cover every 9 months. That's it. That is when they want to come. No ifs, ands, ors, or buts about it. 9 months is just simply too long for a lot of people unless you're a child. We have kids who come in every 6 to 9 months also, but even for kids, I like to see them every 6 months because there's still going to be plaque there. Even if it's not, it's nice to see them every 6 months to make sure things are healthy, because if you have a cavity and you wait 9 months, that's a long time. If you wait 6 months, that's a long time too, but not as long as every 9 months, right? So the only people that I see every 9 months is simply because insurance will only cover every 9 months. That's it, plain and simple. Those seniors perhaps who maybe only have teeth on the bottom or the top, or they're missing a lot of teeth, I may see them every 9 months if they have light plaque. A lot of seniors have thick plaque because their mouth tends to be dry. So I don't know a lot of seniors that have excellent oral hygiene. It's typically moderate plaque, thick plaque too. So even for seniors, I suggest seeing them every 6 months, every 3 months could happen, but every 9 months would be for your seniors who don't have a lot of teeth and light plaque. The only time that I see patients once a year is if they don't have teeth. Okay, so you may be thinking, well, if they don't have teeth, why are you even seeing them? We still like to check, their maxillary arch, their lower arch, to make sure there aren't any, lumps, bumps, sores, just anything like that. We check the top of the tongue, we check under the tongue, sides of tongue, to make sure there aren't any lumps, sores. But that's only if they don't have teeth. If they have teeth, we automatically see them every 9 months at least, preferably every 6, 4.5, depends on the patient. But that's the only time that I will see patients once a year, and that's it, is if they have no teeth. because they probably have a full set of dentures, hopefully. So they like to have those cleaned, and it gives you a chance to have a look at the dentures also. Now, another question you may be thinking, or this may be too advanced for you so far, especially if you're just out of school, is if the patient's coming in every 3 months, when is their cleaning and checkup, and when is it their cleaning? So that depends again on the insurance. I have some insurance companies that will only cover a checkup every year, but they will cover a cleaning every 3 months. So that does depend on insurance, because a checkup is needed for you to take any checkup x-rays, to take any periapical x-rays, for the dentist to come in to have a look. But a cleaning is needed for you to do that excellent job cleaning the teeth. So that does depend on insurance. I see some patients that come in every 3 months, and then 3 months after that have a cleaning and checkup, and then after that it's a cleaning, and then after that it's a cleaning and checkup. So it does depend on insurance coverage. And sometimes, again, insurance companies will cover cleaning and checkups every 9 months, but let's say they come in to have a cleaning halfway through that, so that's every 4.5 months. So they have a cleaning every 4.5 months, but it's their cleaning and checkup only every 9 months. So it's a cleaning and then cleaning and checkup. It's a cleaning and then cleaning and checkup. So does that make sense? So depending on when their recall is, it will depend on insurance coverage or how often the patient wants to have their teeth checked. I have some patients who don't have insurance that say to me, well, I'm okay to have a checkup every year, but I would like to come in to have my teeth cleaned every 3 months. So it does depend on the patient too. And as with anything, you need to be talking with your patient the entire time. See if they have any questions. If they're not sure about something, make sure they do understand that oral health is so important. If their oral health isn't healthy, they're not fully healthy either. If they have a lot of plaque, that harbors a lot of bacteria, right? Which is not healthy at all. If they brush once a day, not twice a day, they will have more plaque. If they smoke 2 packs a day, they will develop more stains, so they should be coming in more often. Now, I tell people who are fresh out of school that once you start the new office, check to see how often the patient has been coming in and follow through with that. So if the patient has been coming in every 3 months, don't say to the patient, well, things look nice today. How about we change it to every 6 months? I would keep things the same as the patient has had. The only time that would change is, let's say the patient has been coming in every 9 months for the past 10 years, but today they have a lot of plaque, a lot of bleeding, a lot of tartar. Then you can say, well, your teeth have looked pretty good before. I'm assuming because you've been coming in every 9 months only, but there was a lot today. So you are due to come in every 3 months because there is a lot there. And at your next cleaning, things will be a lot easier because it will be only 3 months and not 9 months. And always, always say, and if you like, I can check with insurance for you, because there are a lot of offices that are based on insurance only. And that's how patients think too. You know, they think, well, if it's not covered, I'm not going to get it done because it's not covered. You know, a lot of people think like that, and that's okay. But you need to tell them and show them that their oral health is so important, and that if they need to come in every 3 months, even if it's not covered, it's something that they still should do. So I do hope this helped. If you guys have any questions, please just let me know in the comments below for this video. And if there's a certain video you would like to see, just let me know, and I will do that sometime for you soon. So have a nice day. I do hope this helped, and I will see you guys all in the next video.